That is up.
This one.
What would you like to see? People, human people?
Whatever's on your screen, yeah, that's good. Okay, so we will call the meeting to order. So this is you guys at the back. I hope you can hear, but let us know if you cannot.
You speak up, I can hear. It's slightly low.
All right.
Louder, Kathy.
I think you guys can also join the table if you want to come closer.
What a good idea.
Yeah.
I don't know whether there's enough room.
Well, we're friendly.
Close.
We're friendly.
Close. I do a little bit of it.
Yeah. Come on up. That's okay.
Sort of closer. Watch this board.
I think that.
Drew, somebody can go beside Drew.
All right. We're here.
Drew, do you want to see if
There's a place here.
Like.
Oh.
I'm just, sorry.
How long did it?
Okay, so, maybe Paul can grab a chair. We're just bringing people closer because this room doesn't have a great sound system. Matt may be joining us too. So we have some people who are attending in person, and what we have tried to do informally at the start of meetings is just kind of do a check-in to make sure that the meeting is accessible for people. So if you are not hearing anybody, just kind of wave and make that known to remind us to raise our voice. And you will be happy to know that the new council chamber has some design features so that we will be able to actually have good auditory communication. And there are people on Zoom, and this is being live streamed and it's being recorded. And, you know, their sound quality also is something we should check. So are you okay, Peter, with the sound?
I'm okay, thank you.
Okay, and anybody else? You guys are okay? All right, so we will start this meeting of the Accessibility Advisory Committee. And just before we get to the presentation, which is the highlight of the agenda, we should approve the agenda. So I would actually like to just insert an item. So before we talk about the accessibility plan, we can talk about that research project.
The letter of support.
The letter of support for the research. So that will just go between delegations and the accessibility action plan.
Okay. Did you want to put a little break between the presentation and the discussion?
We can do it if we want to. Okay, so can I have a motion to approve that recommendation that we approve the agenda?
So
Nick, yes. Robin. All right, on we go. And then the minutes from the last meeting you have received. And somebody want to move that we adopt those minutes? Nick?
Peter's got his hand up.
Peter, okay, very good. All right, so now we can get on to the exciting part of the agenda, which is the delegation that we have today on dementia-friendly urban planning. And it will be presented by Professor Habib Chaudhry, who is the head of gerontology at Simon Fraser. And he is here with us in person, and he has had some visiting around Bowen to get a bit of a sense of what the community is like. And he has met people at the community center, the health center, and people from Sky. So we have already learned a lot, but I'm just going to pass it over to you, Habib, to share your knowledge with us, and then we will have questions and answers.
So you're going to help me with the slides?
I will,
Okay, fantastic.
unless you'd rather drive.
Um,
Don't have anything to drive on.
no, I mean, no, that's fine.
Okay.
I think I'll just say next, right? And then we have, we tried the video, right? Okay. It's a short video at the very nearing the end.
I haven't actually tried it on the screen yet, but I'm
That's right.
confident.
Okay, then that should be fine. Okay, right. All right, so, yeah, thank you so much, Kathy, for inviting me to be here. Yeah, as Kathy mentioned, I'm Deep Chaudhry. I'm a professor in the Department of Gerontology at Simon Fraser. My background is in architecture, urban planning, and I focus on design for seniors. In one of my focus areas has been design for people with dementia and cognitive issues. So Kathy asked me to talk about the dementia, the project that we have been involved in for some time. The context is that I think there's a lot of opportunities to do some interesting work and useful work in Bowen Island that Kathy is spearheading. But from our perspective, the project that I'm involved in, which I'm going to talk about in a minute, I think I would be curious to see whether there's some interest from the municipality, other organizations, to look at the accessibility issues. I think it's Accessibility Action Committee, but within the accessibility umbrella, the different things that we can talk about. But one of the things that I'm focusing on now is cognitive challenges as a disability. So we talk about physical disability quite often, but when people have cognitive issues, that also an invisible disability that we don't sometimes talk about it because we should do. So with that note, I think
Let's just do a check. Can everybody hear Habib?
can everybody hear me? Okay, very good.
Okay, Daisy, you can cue him if he needs to speak up.
Oh,
Right. So one thing I could do, maybe I could stand up.
Do you want to sit in this chair? Is
No,
that-
I don't actually want to stand. So that might be easier. So getting
all
into
the parts.
Yeah, I'll stand here, right? So anyone can see me. That's how I think you present. So I get into that mode in character of presenting, right? Thank you, Sarah, for helping me this. So just to go back for one sec. So that's the name of a project that we have been working on for about 2.5 years now. It's called DEMScape, as you see. It is an acronym. The acronym is up there. It's a long acronym for Dementia, Inclusive Streets, Community Access, Participation, Engagement. But I'd like to say also that DEMScape is short for Dementia and Buildscape Landscape. How can we create better buildscape landscape, especially buildscape, like streets, amenities, and so on for people who are living with dementia, who have some cognitive issues, right? Okay. So just acknowledgement of the funding agencies. The main funding has been from Public Health Agency of Canada, also from Alzheimer's Society of Canada, and Alzheimer's Society of BC. Our municipal partners are actually longer than what you see, City of Burnaby, Richmond, but we have also worked with City of Vernon, and we're also getting started with City of Vancouver. So quite a few municipalities involved at this point. So maybe Bowen would be another one down the road. All right, thanks. Yeah. So I'm sure we have some understanding of dementia perhaps in the room, but just to make sure we're all on the same page on what is the context of dementia, just to acknowledge that dementia is basically an umbrella term, right? It is a broad term which is referring to loss of memory, other thinking abilities, when that's severe enough to interfere in with daily life. So this is a long discussion that we can have, and we'll get into that. But the point, especially on the Alzheimer's context, is if you see on the right-hand side, these are the typical neurological conditions, diseases that cause dementia. And the most important one, the most common one that you all know about or heard about is Alzheimer's. But even, especially in Alzheimer's, there are signs of dementia, signs of issues that are happening, like neurological changes happening in the brain long before they become strong enough to interfere in everyday life. So what I'm trying to get to is that there are certain things we can do, lifestyle changes that would prevent dementia or reduce the progression of dementia. So that's one other area that is important beyond talking about people who have been diagnosed with dementia. How can we provide support for them? So there's an early trajectory that we need to acknowledge. We quite often don't talk about as much as we should be. And then the second common is vascular dementia, which happens due to stroke, basically, and then other different kind, about 100 plus neurological conditions can cause dementia. So some common signs of dementia, memory loss, short-term memory changes, difficulty in concentration, focusing, language issues, having difficulty finding the word, forgetting things, that repeating oneself, asking questions again, and at some point over the course of, especially in Alzheimer's, people having difficulty in carrying out everyday tasks, activities. So I may not be able to know what to do with certain things or what is called. So there are certain things, right? And then it goes on to, so typically there are 3 stages we talk about in Alzheimer's: early stage, moderate stage, late stages. Late stages, people become more dependent and so on. So let's carry on. So acknowledging that dementia is a global issue, right? So the one thing we know that is connected for sure with dementia, among other things, is age. As we get older, the chances of having some kind of a cognitive issues that may contribute to dementia goes up. So globally, currently, about 50 million people have been formally diagnosed with dementia. In Canada, the actual number is not that 2020, the current number is around 700,000. So in 2030, it will be a million or more. Within British Columbia, it's estimated, underline estimate, not estimated, 60,000 to 70,000 have been diagnosed with dementia. Many of them are female. One important footnote to that, there are many people who are living with dementia, but they have not been diagnosed formally. So they are managing and coping and so on.
And women tend to live longer.
Women tend to live longer, so women
There might be more
statistically more susceptible.
Right.
Yes.
But there are other reasons.
Yeah.
Gender and sex reasons.
So from coming to our project, the DemScape project that I started off with, is acknowledging first that most people with dementia actually live in the community, right? That's the first point that I say. Around 70% older adults living with dementia are under the age of 80 live in the community. So that means neighborhood is important. Neighborhood community is very important for providing services, amenities, and sense of community as well, community connections that you have as a resource in Bowen, right? So the next point is talking about spatial navigation. It's a technical term here, and that is something very important to think about and acknowledge and address when we talk about people living with dementia and their mobility and participation in the community. So what I'm pointing out here is that spatial navigation is basically how we move around in the community. And that's something most of us, who are cognitively, alert and high functioning, don't acknowledge, because we do this in autopilot. How do we move on the island or go to somewhere else? We do it because we know how to get to places. But when we talk about somebody who is living with dementia, even somebody having mild cognitive impairment, they may have some difficulty in spatial ability. Once somebody has been diagnosed with dementia, in the trajectory, there will be challenges in spatial navigation. So that can contribute to anxiety, feelings of loss. So sometimes you may hear on the news somebody getting lost, somebody actually getting hurt, and so on. That's an interesting area right there. We don't do a good job in Canada and many countries about documenting how many people are getting lost every year or getting hurt and so on. So there's a group actually in Canada who's working with law enforcement about tracking that data to have some more targeted intervention. All right. So there's a shrinking world. Some people talk about shrinking world, that as somebody is living with dementia at a certain point, they become dependent on their care partner or somebody else for them to move, help them move around, right? And then the world may be shrinking for them to where they can go, where they can participate. So that's one of the things we try to look at in our study in Metro Vancouver. Next. So we started off with the built environment, but we went beyond that. Our main focus was for intervention purposes. It still is the built environment. So like streetscape, how are streets designed? Do we have a sidewalk? Or how close are the amenities? Can we walk to a grocery store? Can we walk to a pharmacy, right? I know in Boyne is quite different because it's a more like a island/rural context. People are driving a lot, shuttle buses, people are walking, but we talk about like in an urban context like Vancouver, people are, amenities might be closer to a certain point. But again, it's all spread out as well. It's depending on which community we're talking about. So the built scape, the built environment of the neighborhood becomes important, especially in more built up areas like urban centers. Here, things are different, and that's what I would be interested to know more about as we move forward. Next. So now I'm getting into nuts and bolts, or the flesh of our project. This is referring to what we know from other studies about what are the dementia-friendly and inclusive principles that are important when you talk about the built environment. Before you look at those 6, I want to point out something that you'll notice in the top, it says dementia-friendly and inclusive principles. And there's a reason I put that up, which says dementia-friendly and dementia-inclusive. Quite often you'll hear about dementia-friendly, or you might have heard about age-friendly communities, age-friendly city. WHO, World Health Organization, came up with age-friendly community years ago, and there are many cities across the world, including Canada, they said they're age-friendly communities. When we talk about dementia, and when you talk with people living with dementia, they say, well, friendly is not the best word. Friendly has a patronizing connotation and become friendly to you, right? Because the issue of agency, issue of participation, issue of autonomy, these are important issues for people living with dementia. So from that perspective, we would say, not we, but many people would say, dementia advocates would say, let's use the word inclusive. It's more engaging inclusion rather than being friendly, right? So I just want to make a distinction. So there are 6 principles that we are just mentioning quickly. Familiarity, comfortable, accessible, distinct, legible, safe. These are broad principles that people have talked about, scholars who have done research, and there are certain municipalities that have adopted bylaws and standards that are guided by these. 2 of them are very important. 3 of them are very important, actually. Familiarity, distinctness, legibility. When we talk about people having wayfinding issues, like the navigation challenge I was talking about, right? Familiarity is important. Distinct environments, landmarks are important. Legible signage. How are we designing our signage in the city? That's important. Because quite often at certain stage of dementia, people are not able to read. So what is a good sign? Right? So we have to think about what is a good sign. All right, let's carry on. So these are our project objectives. There's a lot of text here. Excuse me for that. I'm going to simplify what we're doing here. In our project, we collected data, we engaged people living with dementia and asked them, where do they go, right, on a regular basis? And how things might have changed since the diagnosis. Certain places they're not going anymore. For example, they talked about loud shopping centers. They don't want to go there. They avoid certain streets, for example, because they're more noisy. Certain restaurants they avoid. certain banks are not dementia friendly. So we looked at that, how things might have changed in the trajectory of places that they're not comfortable with anymore. We basically looked quite a bit about asking qualitative questions about where did they go, where did they walk. Our main focus was actually walking, looking at basically Metro Vancouver. We also looked at Prince George, but we wanted to focus on where do people walk on a regular basis. That was the main goal of this main bulk of the project looked at that and what kind of challenges people face. We did an innovative community-based participatory approach. I'll talk about it in a minute. Basically, we had a walk-along interview. I'll mention that, which was fascinating. We walked with them, with people with dementia, sometimes the care partners, and then we video recorded that. We asked them about questions about that walking process, and we learned a lot based on that. And then the last point is what we call knowledge mobilization resources. So fancy term, basically meaning what is the output beyond academic papers? What else are we doing, right? That's where knowledge mobilization resources come in, which means how can we work municipalities? How can we work community organizations based on our findings to influence policy, influence practices and programs, right? So that's the knowledge mobilization resource part, which is what I will basically focus on in the next few slides. All right, before I do that, I just want to put the context of what did we do in terms of our data collection, so to speak. So we engaged with 32 people who are living with mild to moderate dementia and the care partners. So in Metro Vancouver, there were 26 participants, 11 people were participated on their own, but 15 participated with the care partners. So among the 15, they are more, we might say, like moderate stage dementia. They're not going out quite often on their own. They're going out with their spouse or somebody in the family, right? So that's a care partner. Care partner could be a family. Quite often they are, but sometimes they're also friends that they go out with, right? So that's a dyad that I'm talking about. And we had a group of colleagues in Prince George at the University of Northern British Columbia who were part of the team, and they engaged with 6 participants in Prince George. The idea of including Prince George was, as you might imagine, it's interior, the landscape is different. They don't have much sidewalk like Burnaby or Vancouver. Their climate is different. Winter is quite different, and so on. So the issues are different there. So we have some interesting data from that. So this is our data collection. We had a very extended engagement, so to speak, with our participants. We had 4 sessions, as you see here, with the 32 participants in the study. And all of these 4 sessions did not take place on today and tomorrow. They took place over 4 to 6 weeks, right? So maybe we had 1 session, first session today, scheduled second session next week, and so on and so forth, right? So what did we do on this session? The first one was more about understanding the demographics, their age, gender, beyond that, we asked some structured questions. But where do they go regularly? How things might have changed over time? Are there places they don't go anymore? And how they see in the future, or at least they might not go in the future. Session 2 was where we started talking about more overall, how important it is for them to be mobile in the community, to stay engaged in the community, right? And then we also did route planning. Route planning means it's connected to session 3. Session 3 was the most interesting, where we're calling it, as it says here, walk along interview. So we walked with them to a destination they regularly go to. But in order to plan for that walk along, during session 2, we did the route plan. So we asked them, where do you typically go? Every 2 weeks. Okay, every 2 weeks, I go to the community center. Every 2 weeks, I go to grocery, wherever they might go, right? So we planned with them on during session 2. And during session 3, we actually walked with them. Our team walked with them. And as we walked, we asked them questions. We video recorded the actual walking from their vantage point. And then the final session was a sit-down interview. But between session 3 and session 4, our research team, looked at the video that was recorded during the walk along, and we selected some clips from the video that were more interesting. That they talked about, they said, at this intersection, I have to pause, think, do I take a left or right? Or they talked about something that is memorable, so it's a landmark for them. So something interesting clips that we used during session 4, which we call video elicited sit down, meaning that we showed them those video clips that, remember, we walked last week with you. These are video clips from our walk along. Do you have anything else to add? So people elaborated on that because when we're walking, it's not always easy to walk and talk, right? And they're trying to pay attention to things. But after that, in the last session, they're sitting down in their own home, we are there and showing some video clips, and then they have an additional opportunity to talk about their walk along experience. So we have a lot of data that we are analyzing now. This is just showing an image of how we collected how the walk along interview worked, which is kind of an interesting operation. So just a quick point here. So if you look at on the left-hand side, or actually right-hand side, on the left hand, there's a person, gentleman in blue. So he is a person living with dementia, and he's one of our participants. He's walking, and then we had 3 team members from our research team walking with him. One person is on the right-hand side, the guy he's a project coordinator in a brown jacket. So he is walking with the person and then asking occasional questions. And there are 2 other team members. And on the left is Carrie, who's one of our project coordinators. She and another person will be behind we use what we call GoPro camera. So you have these small cameras, video cameras on top of your head. We have video recorder from our team member. We actually invited people, the participant, the persons living with dementia, put the camera on their head. And many of them actually did. And it was an interesting exercise that we did. Where is the best place to put your camera on? So we piloted that. For example, we piloted that if you put the camera on the body, some people will be comfortable wearing it, but it doesn't capture when you're moving your head, right? So as you're walking, you're moving your head, but it's looking at that direction. So eventually we found out the best location to put your camera is on your head, because your head is moving and it's capturing the exact the vantage point perspective. So anyway, many of our participants actually put the cameras on. So we got really interesting video footage. So these are our what we call substantive categories that are coming up, meaning these are interesting finding buckets, right? Like we are having a lot of data about the physical and environmental aspects of their walk along. We have a lot of cognitive aspects, how people plan their walk. They avoid certain routes, things like that. And then the psychosocial and emotional aspect, how people enjoy, for example, interacting with others as they go along their walks, right? And the other, memories, familiarity with neighborhoods, things like that. Those are coming up. Temporal aspect, how people talk about reminisce as they walk. I say, okay, I know I've been to this place so many times, good memories and things like that. So it's temporal aspect, how things may have changed also over time in terms of walking behavior. So these are bucket or categories that are emerging in our findings. So this is where I am really interested. This is where we are working with 4 municipalities, as I mentioned to you, with the knowledge mobilization resources. So we have developed 3 resources or tools. The first one is dementia inclusive, what we call dementia inclusive planning and design guidelines. So I have brought with me copies of this. So a bunch of copies. Please feel free to take anyone. This is our website. So what is this? So I'll talk about it in a minute. This is to inform municipal planners for making decisions in the neighborhood planning and interventions. Second one is an environmental audit tool. Environmental audit tool means it's a tool which is not for academics like myself. It is for community organizations, people living with dementia, to actually go out in the community and do an audit, meaning you go to. So it will be interesting in Boyne, things are different, obviously. But if you think about Vancouver, For Burnaby, we have street segments, right? So street segments, so that's where we focus on in just for audit. So we have to, I mean, if we were to do our audit in Bowen, we have to modify a bit, adjust things so that we can do proper audit in the streetscape of Bowen Island. The third resource that we developed was what we call education advocacy video. I'll show you a short clip of that video, which is basically increasing community awareness about the importance of issues that people living with dementia have in the community participation. So dementia inclusive planning and design guidelines, that's what I mentioned as the first resource. This is for municipalities, developers, community organizations, and people with lived experience. But our main target is municipalities, because there are many municipalities across Canada, including British Columbia, that have what they call dementia-friendly action plan, right? So dementia-friendly action plan, City of Richmond has a good one, City of Burnaby has one, certain municipalities, Vernon is just building one, we work with them. So this fits in quite nicely, this planning and design guide fits in quite nicely with their dementia-friendly community action plan. So the guide was developed based on years work. We looked at the gray literature, meaning what does gray literature mean? That means what municipalities across the world, different municipalities, like for example, there are certain municipalities in Australia and Scotland have done a great job in actually implementing some of these principles that we have talked about. So we collected what they have done. We looked at the empirical literature. We interviewed with municipal planners in 6 municipalities in BC about what they're doing in their DFC or dementia-friendly community action plan. We had a community forum where stakeholders came. These are people living with dementia. These are community organizations, municipal partners. We got feedback from them, and then finally we came up with what I have here sharing with you, the final version of the plan, the guidelines. So the guidelines is basically structured beyond the 6 principles. There are 3 realms, and I'll show you what is a realm. And then within each realm, there are strategies. Overall, yeah, we'll just pass this along. Good. And also, let me pass this along. These are also cards that are, there are 3 different cards that these one. It's just a promotion of our project and our resources that I'm talking about. So anyway, the realm strategies in action. Let me just go to the next slide. I'll show you quickly what they are. Mindful of the time here. So the guideline that I'm sharing here has 3 realms, meaning there are 3 scales. So if you are municipalities have different levels of intervention. The first one is a neighborhood scale. Neighborhood scale meaning they would do land use designation. Land use designation is a critically important decision in municipality. How do you use your land, right? So it can be single use, it can be residential only, it can be commercial only, it can be mixed use as well. Here's a big issue, for example, in the city of Vancouver, right? In terms of rezoning, if you want to bring a new type of function in a primarily residential area, you have to apply for rezoning application, things like that, right? So that's one issue. Street grids, how streets are done, that these are part of the neighborhood scale. The second scale or realm is street scale, which is a segment level, right? Again, we have to really revise this, adapt this for Bowen, because it's basically more for urban centered and suburban context. So, but there's certain things that will still apply here, like pedestrian paths, right? So where do people walk when they walk on Bowen? So that will be part of street scale. And then finally, detailed design scale, which applies to any community. So for example, seating, what kind of seating do we have in the public space? Where do people sit? Benches, right? Public art, public toilet came up very strongly in our study. People would choose where they would walk based on if there's a public washroom or not, right? Many of them actually do that. Signage, I mentioned about signage. What is the appropriate signage for somebody with living with dementia who's not able to read the street sign anymore. Right? If it's a symbol, not any symbol, that's another discussion. That has to be meaningful symbol, icon. Okay, let's move on. So, okay, sorry, you are ahead of me. Did you skip something? Can you go back one second? No, that's okay. I think I skipped one neighborhood, so that's fine. This is giving you just example. Let's go back first. So, yeah, this is giving a bit more here about within one scale. For example, the street scale, we have certain strategies, and then we don't have. Sorry, but in the guide you will see that each strategy, for example, pedestrian crossing or transit stop, each strategy also has a number of actions. Okay, what exactly can you do within each strategy? So you got into that detail level of, and we a lot of examples like images from other municipalities here. Next. So the third scale was the detailed design scale, which is I mentioned about seating, public washroom, signage, lighting, acoustics, and so on. So the key step for implementation. So this is how we are working with the 4 municipalities now. We are working with them to identify what are the high priority strategies for them. It may be slightly different for Burnaby versus Vancouver versus Prince George, depending on how they have this, how they're thinking about their dementia-friendly action plan. So we're also finding what we call hotspots, where certain intersections, certain segments, where we are conducting environmental audit, like we're going there and with the specific what is the hotspot? Hotspot means a location which is close to a transit stop, a location which might be an important shopping center, which may be close to a community center, where there's a lot of traffic, basically, pedestrian traffic. That would be a hotspot. So we are trying to see how are those hotspots working in Burnaby, in Richmond, in Vernon, in Vancouver, and then we will provide information about what can be done to improve some of those hotspots. So that's the pilot project that we are doing for making some changes. And then overall, of course, how they can use the guideline as a basic framework. Next. Okay, the audit tool, very quickly. Yes, user-led audit tool. Next. Yeah, next. Well, maybe I have repeat slides here. Carry on. So these are, just wait for 1 second there. Back, go back. So these are the tool domains. So what is a tool? This is an audit tool. It's called SWAN. SWAN stands for a stakeholders walkability audit in the neighborhood - dementia. Basically, this tool SWAN has different versions. One version is for dementia. One version is for people with hearing loss. One version with people with vision loss. One version with people with mobility issues. Of course, they overlap quite often, but the specific one for people living with dementia. This is SWAN-D, right? So anyway, it has got 5 domains: functionality, safety, appearance, maintenance, land use, features, social aspects, and so on. So I'm not going to talk about this. We don't have the time for that, but just to give you an idea, the way we do this is, again, imagining, would there be segments here in Boyd? Like an intersection? Do you have like yeah, I think you
Between the
have.
ferry and the four corners.
Yeah, you mean intersections?
Yes,
From the ferry up
yeah,
to
from
the
one
intersection.
to another, yeah.
So if I'm thinking of like our active transportation plan, there are, I think, things that we have identified as, what's your word?
Segments,
We
Yeah.
may not call them that, but I think
right.
they are known to us.
So there are certain segments which, that could fit in with this. But that's how this tool is designed for segment level data. So we start with one corner of a segment, and then and we walk crossing, we go to the other side, we walk the segment and go around. And as we are doing this, we are looking at the sidewalk, the crossing, what kind of businesses are there, amenities are there. So we collect data, but that is from the perspective of somebody living with dementia. So we're always doing this, somebody with lived experience. Next. And then finally, we have this, what we call the education advocacy video. So next, please. So what is this? This is an 8-minute video that we have developed based on 3 case studies. These are 3 individuals who participated in our Dementia project who are living with dementia in BC, and they talked about their experience, and we had sit-down interview with them, and that is basically a video that is we have used this video for raising awareness with community organizations in municipalities about understanding the voices, perspective of somebody living with dementia. It's one thing for me to talk about, that's a different thing when you hear the actual voice of a person having that experience. So that is the whole idea of this video. Challenge stereotypes. So we already mentioned this, these are the 3 individuals who participated. They talked about the mobility engagement and how they cope, how they adapt their walking behavior, their mobility behavior as they're out and about in the community. So what I'm going to do now is that before you click on that, we have a short version of the video, which is about a minute and a half. So I would like to share that with you just to give you an idea about the full version is on our website. If I encourage you to take a look at the website, you'll see the full 8-minute version, a bit more information about that. But just to give you a flavor, yeah, let's do that. All right, let's see if it works. There's an audio here.
Oh, you know what, I'm muted, that's why. Sorry. The big screens. Screen?
Yeah.
Get out my volume.
Yes.
Perfect, there you go, thanks.
Like the computer audio, right?
Well, I'm gonna try to put the big, this,
Okay.
sorry, guys.
This is the audio. Okay, that's
Fine.
all right. Let's give it another try.
Sorry about that. It's fine, that's
This
what's.
one. Just click once.
It's not projecting. I don't know why it's not making a sound either. What I could do is, through your email, just do it online. That works.
Okay.
Sorry, yes, we press the sound.
Yeah.
I mean, my brain.
It enables us to do so much.
Yeah.
It fails. Yeah. It really is a good song. So we have used just moving forward after the video, I talk about the engagement we have done so far with Burnaby and Richmond, and also with Vernon. So we have done 2 things. One is we have done a community forum, one in Burnaby, one in for all 3 municipalities, where we invited the municipal partners, meaning these are transportation engineers, urban designers, physical planners, and then also community organizations, also people with dementia. So we watched the video together, and then we had a guided conversation. We had small group interaction, and we said, okay, what have we learned from this video, right? From these 3 case studies, and then how can this apply to my organization? So there are like service providers in Vancouver that said, okay, I can understand better what some of my clients are going through when they're out in the community. And then some organizations said that I can participate in your audit and we can, or with my clients, and take this information to Vancouver Council or whatever council they're with to ask for some interventions in certain areas. So we have done that community engagement with the broader community context. The second thing that we have done is targeting or working with the municipalities themselves. So that's again with Burnaby, 3 municipalities where we had guide. The first session was community forum, not with the planning and design guide, but with the video, right? That's about understanding, raising awareness. The second one was municipal partners, nobody else, but really focusing on what they're doing now in the dementia-friendly community. The guideline
Sounds like they're up there then.
that they can use. So I think this will save some time after we watch the video. So that's the last few slides about the community engagement that we already conducted with a few municipalities here. The other thing I would mention is, I don't have that on the slide, City of Vernon was an interesting case. Vernon they have I think they call it accessibility action plan. So we have worked with them, and the end result was slightly different. They created what they call a playbook. Okay, so it's a playbook, meaning it's a toolkit. And the toolkit, their toolkit's target is other municipalities. And they're saying if other municipalities is interested in a dementia-friendly community, they can look at our playbook. So their playbook is basically a guide that talks about process and engaging community in a more meaningful way, getting feedback. And they do use some of our guidelines and resources, but it's a more broader, generic playbook, so to speak. So yeah, I'm happy to. It's actually it's passed their council recently. It's on their website, and I'm happy to share that playbook information if you are interested. But that was an interesting experience because Vernon is also obviously different than Vancouver and Burnaby in terms of the landscape. So we did a community forum there, and we actually conducted street audit in Vernon. They're trying to first focus on in one of the parks and making the park more dementia friendly. So we looked at that as well. Okay. Did I hear some?
I don't think the sound is,
Okay.
work on my computer, sorry.
Actually, maybe we have the closed captioning. That
Yeah.
will be the
Okay.
default. That's why just to go with that. But the sound is not working. It's a short video anyway.
Okay. This is closed captioning, yes. Okay.
Yeah, so let's go to the big screen. Full screen.
So I get a little sound in my line.
How did you lose so much weight?
This is an ad in front of you too.
You'll
skip
me a
ad.
message, baby.
This is it?
No, that one. Not that one.
Not that one.
Not that one. No, it's ours is a 1.5 minute.
I think we moved on to the video, so that's what
Really tried hard.
Oh, okay.
So just the exit. And then go back to my presentation,
Well,
PowerPoint.
or this
Oh,
one, landscape.
no, the actual PPT, the PowerPoint file.
Oh, I think we're on this now. Is it
Oh,
this one? No.
I think we may have to just share the link
yeah,
and have our discussion because we have,
right.
I think maybe.
I've been going through YouTube on
Yeah,
this.
let's just skip that and let's go to the PowerPoint and then see if anything else is there I want to mention.
Okay,
Or wrap up just.
there.
Well, you've probably seen the presentation. You might be able to narrate us for.
Yeah, right.
Well, actually, we can see it here. So even one, can we just, is it not connected to?
We went to the doctor's
So maybe I'll just narrate briefly. There's 3 people here.
Okay, sorry about that.
Uh,
Narrate.
Yeah, Lynn is somebody who lives in Richmond, and she talked about some issues of, she had falls before, so now she's very careful as she walks, and even like simple cracks are problematic for her. She's very careful as she's walking. Okay, this is okay. We got this one going.
Why
So
can't you just have the
can you unmute this?
It will play through her computer, but not through the speaker, I think is the issue.
Okay, but that's okay. Let's get this going so we can see the text. So if you go back, open start new. Yeah, so that's, we were doing this in just after COVID, so COVID precautions were going on. Oh. Okay, well, I think we probably won't have.
It's a slow connection.
Please send us the link.
Yeah, okay, sure. So by the way, it was great to have Lynn. Lynn is a nationally known advocate on dementia. She speaks to different organizations within Canada. Esther is one of her participants. Esther talked about the washroom quite a bit. You know, she lives in Burnaby. She really plans her routes based on where she can, she just goes on certain routes. And then she talks about, okay, the final person was, this is Niels. So Niels has Alzheimer's. Maureen, his partner. And Niels was talking about, if you look at some of the footage, that's in Prince George when Niels is walking. There's no sidewalk. So how he was talking about how he walks, cuts through different grass and trails to get to places, and how he's careful with his walker and so on. So he goes out with his, with Maureen. He doesn't go out by himself, not because of physical disability, but because of his dementia. Okay, let's move on.
I just want to say something about the washrooms. So I work on Bowen with seniors with and without dementia, and it is a universal issue that my clients are reluctant to go out because of bladder control.
Yeah.
So this is an obsession because they do not want to be embarrassed. And we have a shortage of washrooms that are available in our community. So I just thought.
Yeah, I mean,
There's an opportunity
so
to
you are
say
not alone. I mean, that's, we're also struggling with that.
Yeah.
Also, even in, an urban place like Vancouver, we don't have public washrooms. We have very few, really. And people would just know where they can stop to get to a community center or some to get to washroom. So there was a big discussion, by the way, of having washrooms at the SkyTrain stations in Vancouver. And then ultimately, it was going to happen. Ultimately, they just decided not to do that. Issue about who's going to manage that and so on. But that's another whole discussion that we probably don't have the time to get into. But it's a real issue from perspective of many seniors, and not it's a seniors issue for people who have some bladder control issues. And for dementia, it adds to that issue about the route planning they do anyway because of cognition. It's an additional thing.
Yes.
Yeah. Okay, let's just back off and then just go back to my slides.
Okay.
If anything else is there. Just wrap up. So okay, this is not connected anymore.
Oh,
Maybe
it's on, it's just connected to the video.
so we
Yeah,
can
reshare
close that one. Yeah, just close this one and then just open the PowerPoint. Yes. So, I mean, I basically shared with you the last few slides I had about community engagement with the few municipalities. Just want to see anything else. I don't think I have anything special in the last few slides. So anyway, I think what Kathy and I have been talking about is, as part of your accessibility action plan initiative, are there ways that we can think about issues of dementia and making things, what would be more meaningful here? From my perspective, one of the things, I'm sure Kat's perspective as well, is about to know what's happening, what are the issues people are facing. Like, for example, your comment about washroom, what other issues, somebody who might be having some memory issues or cognitive issues, how are they coping? Okay, are there people like, I'm sure there are people with dementia and cognitive issues here. So how are they managing? And one good thing I know and hearing about that quite a bit is people know each other, strong sense of community. And that's a big asset here, right? So is that something that can be leveraged upon and then maybe have a broader education on dementia, people who might be supporting each other anyway, because we are part of the Bowen community, but to what extent we know what is our dementia education level like, right? Or issues like brain health, what can we do in our lifestyle so that we don't get into that situation? So because a lot of the discussion right now in this community, in this space of dementia is about prevention and potential reduction of progression. So, and some of the things we talk about, lifestyle change, social connections, diet, healthy habits, and so on, that we talk about for chronic illnesses like hypertension, like diabetes, like other things, are also related to dementia. You may have heard about this important statement that what is good for your heart is good for your brain, right? So there's a connection that we need to emphasize on. And so there's a built environment aspect for sure, but there are other aspects that might be relevant as part of this. And I don't know the scope of the accessibility action plan, but yeah, I'm looking forward to some exchange. Well, maybe you don't have the time.
Yeah, I
Too much
think we
today.
are,
Yeah,
we are over time, but I think we should have at least 5 minutes if people have questions or comments.
I would encourage you to look at our website if you get a chance. Yeah, project website to Demscape. If you just
Some of
Google
the-
Demscape,
The links are on the
On the
Agenda.
agenda.
on the agenda. Sorry.
Yeah, so I think one of the takeaways, I think, is you've got a lot of materials that we don't have to reinvent, that we can use. And then also we can
Yeah,
work with you and students and learn from the other projects and also learn new things about our context. And that may help some other smaller communities. So
that's right.
so I think in our plan, in our report, that's a very good thing, is to draw on these external resources
Mhm.
so that we have them as a guidance. So Nick, did you have other
All
questions?
right, I'm going to go to the website.
Okay, good. When you go to the website, quick tip, there are different tabs. Click on the knowledge mobilization tab. Knowledge mobilization, that would get you to the video, the guide here, a digital copy that you can download as well.
I just
Thank you.
remind people when the municipality did the public consultation, many people replied to the survey saying, well, I don't have a problem myself now, but I would like to, prepare for the future. And that I expect to have one. So I think that fits with the idea. You don't have to wait until you already have the problem.
That's right.
Much of what the municipality could do will help people along the way. Other questions?
I have a question. Why did you use such a small sample in your study, your initial study, and then in your interview study? Was it because of your own staffing, or was it because you couldn't get
No,
the people in the study?
yeah, thanks for the question. So we did a qualitative study. So that requires a lot of engagement with the participant in terms of qualitative interviews, which takes a lot of time because we ask open-ended questions. So instead of having a structured questionnaire, people can answer quickly. We would have 1 hour, hour and a half sessions, and we have 4 sessions in total. So even if, so with all the data that we collected, we really, our goal was not to have a generalizable finding, so to speak. So it's not about like a finding that we can, generalize to the whole population, but it's about understanding the richness and complexity of the issue. So we want to do qualitative interviews. That's one reason. Second reason, very quickly, because of our methods, anybody doing direct, like a study, a research project where you're engaging with people living with dementia in a direct way, it is quite a bit of a challenge to recruit, meaning that people would not be comfortable in participating in interviews. So we had a lot of instances, for example, where we had a massive, recruitment process going to adult day programs, community center, neighborhood houses, Alzheimer's society support groups. Quite often there would be people living with dementia who would say, I want to participate. And then they would check with the care partner, and then next is not a good idea. The spouse or caregiver would say, maybe you shouldn't do this. So my point is, it was challenging just to recruit people, even with this sample size. But so our goal was, for example, actually was 30 participants. We ended up having 32, and that was a lot of groundwork that we did. But the main reason was the qualitative data, which is a lot of data we are mining through at this time.
Would you be willing to come back and speak to a community group? Just a general community group? For
Sure.
example, Skies Community.
Yeah.
Speaker program?
Yeah,
Okay,
absolutely.
great. Thank you.
So,
Thanks, Abby.
so like, and for the purposes of the Accessibility Advisory Committee, is there something you could see us doing that would kind of bring this together?
I think we should really spend some time talking about it. Yes. I really appreciate the fact, well, we all appreciate the fact that we've been able to speak up and meet Dr.
I appreciate your work in this field. As perhaps a consumer of your ideas down the road.
Thank you. Yeah, I mean,
Thank you.
I didn't mention that there are very few studies that have looked at what we're looking at. This is the first one in Canada, actually. We're talking about understanding firsthand about the experience of people living with dementia in the community. There are a lot of studies that have looked at care homes and people living with dementia, but not so much in the community. There's one study in Australia, one in the UK.
Speaking personally, I prefer to live in the community.
Right,
As
of
much
course.
as possible.
Exactly.
So I can. Thank you.
Yeah, that's the whole idea here.
Yes, I think you hit the nail on.
Yeah.
So this idea of aging in the right place is kind of the new
Exactly.
message. Anybody else?
Could I just make a comment? You know, it's not just for people with dementia, we need help with
Yeah.
intersections. We need for adults, children,
Yeah.
and adolescents, crazy people. So if there's a spectrum of needs here.
Well, thank you for saying that, Lynn, because this is something we always emphasize, because there are municipalities that have age-friendly community plan or accessibility plan. So it fits in with that quite nicely, because we focus on dementia, and a lot of this is about, we talk about, like, I can change the title and say age-friendly. I can talk about plan for people with disability or kid-friendly or whatever. There are certain elements that are specific to cognition cognitive issues. So those are that's an additional layer. But bulk of it is exactly what you're talking about.
And the knowledge translation education part is so critical, which you've got as one of your points.
Oh, I do have one more question. Did the municipalities provide you with funding in order to do this?
Good question.
I've been wondering about that.
Yes and no. I mean, so we are getting commitment for the intervention piece. So making that, I mentioned about doing audit in hotspots, and then they are committing to make some funding to make some intervention. But that project is actually funded by MyTax. We talked about MyTax.
Yeah.
So the main project was funded by Public Health Agency of Canada, the municipality engagement project is funded by my tax, and that's how we have been working with them. But yeah, yes and no. I mean, they're committed to the end, but right now it's funded by my tax. That piece.
And there are a lot of students who
Correct.
who had a learning experience while doing work.
Yeah, so at any given point of time, we had 35 to 40 students working with us.
So that is a different sort of manpower, person power. But it's also a great experience, and it's also a great way to influence the future
Right.
by having people engaged in that learning and development.
And I'll quickly acknowledge Daisy, who's sitting quietly behind. She's from the UK. She's a MyTex intern working on the Dreamscape project.
All right, well, I think there's a lot of good specific information and a lot of information we can generalize to our accessibility more generally. So thank you, Habib, and we'll see you later.
Thank you very much. For sure. I'm
Well, this is
sitting in one place for too long. Good point, right?
right.
Learn about prevention.
Kathy, are you continuing your?
Yes,
meeting?
yes, you have a lot of things to
Is
do.
there going to be a council meeting after that? No?
No,
I believe so.
I think there was. It's Monday afternoon. So maybe you can take one of those documents. Sorry.
I've downloaded it.
You can. All right, so our next agenda item, I think just follows on this in some ways. I don't have a screen anymore, so I'm not
I
sure
think
what,
someone might have kicked the power cord by
Did I do
accident or
that?
something.
I don't know
Is it-
where Pete, if you
Just
just
went
want to see
out.
Peter. Maybe it ran out of.
I'm gonna go under, here. This went off in the middle. It's a good day for checking this group.
Yeah.
It's on the power.
Is the power bar turned off?
No, it's on.
Oh,
Right.
now it's, something's happening. Something's on the screen, it has power.
I wonder why I just turned itself off.
Yes.
Mystery Tech Day.
Yeah.
Mercury's in retrograde.
Yeah.
Hmm. Good. Hmm.
The only thing I'm really worried about is if we can see Peter.
We might have lost Peter. You would see him back there. He's good to leave at 5:20.
I'm here, I can hear you,
Oh, okay. Thanks, Peter. Okay, so there's probably that one too. That's good.
but I am going to have to leave in about 10 minutes, I'm afraid.
Sorry about that, but I'm glad you're here now.
Thanks.
Okay. So we don't see you, Peter, at least I don't see you, but I don't know if
Well,
in a
minute, this second.
Steph can see you.
That's I just turned off the video because I'm sitting in the sun, so it's very high contrast.
But you can, if you need to
I can,
get.
yeah, I can see everything, and I really enjoyed that. I thought that was very interesting. Thank you.
All right. Okay, so if we ignore you, just shout, okay? And don't be afraid to interrupt. All right, so I would like to there's been some email about this. I think we might have spoken about it. We've had a lot of, over the various meetings, had some suggestions about research funding opportunities or project funding opportunities. And the ones that are province-based, we need to finish our report first. But this is an opportunity, as Habib said, his work has largely been funded by the Public Health Agency of Canada. And there is a call out for letters of intent now. And the category we could be in, the municipality could hold the funds, but it's a lot of administration for them. And I was approached by the VP research of the Alzheimer's Society of Canada. And they would like to be the lead and deal with the accounting and the financial administration. So we could get money and just do some work. And it would be about $250,000 a year for 4 years. And how we would plan to respond to this call. So I handed out, I don't know, Angus, if you passed one today.
I'm gonna jump in front of you, I forwarded this email to, our CAO and CFO.
Okay.
And there's quite a long response. Have you seen the response? No. Okay, so we're not gonna use this letter?
No, I just kickstarted it.
Okay, cool.
But, so I don't really care what they write,
Okay.
but I'm interested in them hopefully writing something.
So what we're looking at, as the mayor of Bowen Island Municipality, I'm pleased to offer this letter of support towards a letter of intent as part of a submission of funding from organization name. Recognizing our aging demographics here on Bowen, it's important for all of us to improve our awareness, understanding of dementia and its impacts on individuals and communities.
Beautiful.
Wow.
Okay.
Nice.
All right, so this draft that I've sent out is kind of just to kickstart things, but what it does remind you of, if you haven't looked up all of the information that's been flying around on email, is that the purposes of the funding from PHAC is first, projects to optimize health and well-being of people living with dementia and family and friends caregivers. And the second objective, and you can do one of both objectives, is increasing knowledge of dementia and risk and protective factors. So we are on topic, and this is to be community-based research and health promotion research. It is not about, hiring health professionals to do services. This is about public health information. And what the Alzheimer's Society, came to me wanting to do is recognizing that dementia isn't a thing unto itself, and that its connection to hearing loss is a hot topic, and they would like to work on that. So they have beautiful programs and things that they do for people that have been focused on dementia, and now they want to kind of embrace other accessibility issues, with hearing being the lead one. That because people with dementia live with hearing loss and vision loss and, other factors, nobody has just one thing. So that is the intention. They want to change at the national level how they do their programming so that it becomes accessible. And then the Bowen piece would be to be like the kind of this isn't the right word, but kind of the demonstration of how we could actually do what should have been said. And what he said, I'm going to underscore, is, it's about dementia, but there's also other aspects of accessibility that converge with dementia and with healthy aging. So this is kind of fits right in, I think, with what we're talking about in our plan. And it would give us money for renting space at the community center, or buying equipment for accessibility, or hiring people, or funding students. So it would give us some of the funds to actually do things and to evaluate them. So also some of what he spoke about in terms of investigating, what is the problem, and if there are, for example, things that we can do with the new community center, and making it accessible and open for people to use in ways that align with our accessibility goals, then what are the outcomes? So it gives us the money to do a bit of evaluation, pre and post sort of evaluations. Anyway, what I would like, this is just a letter of intent. So the first thing is they decide, Public Health Agency of Canada decides if they like the idea. And then if they like the idea, then the full application, which has a budget and much more detail, goes in the fall. So this is just the letter of intent stage. And what I am hoping is that Steph made a reason.
It's actually, I'll do a share screen or it's on a Word doc.
A couple of questions.
Sure.
Do we, like other opportunities for funding,